Good afternoon to this afternoon's media availability and COVID-19 update. Just a reminder of some new federal supports that are coming to the community at large throughout the country. The feds announced today that they are investing $2 billion to support diagnostic testing and to purchase ventilators and protective personal equipment, including for bulk purchases with provinces and territories. So help is along on the way for those items. The provincial announcements last night, the province announced it was extending the declaration of emergency to include the mandated closure across the province of all outdoor recreational amenities such as sports fields, playgrounds, and that's effective immediately. Green spaces in parks, trails, ravines, and conservation areas that aren't otherwise closed would remain open for walk-through access, but individuals must maintain the safe physical distance of at least 2 meters apart at all times. This afternoon, the province also announced that schools and child care centres will remain closed to protect the health and safety of students and staff until May 4th, 2020. And as the date comes closer, the decision will be reevaluated based on public health advice. Private schools, licensed child care centres, and early on programs also remain closed until April the 13th, according to the declaration of emergency, which only allows closures to be extended for a 14-day period at a time. So select centers designated to support frontline healthcare workers and first responders will remain open, and we'll have some of those here in Hamilton that are essential and helpful for service workers that they can get access to. City closures as of today. Unfortunately, today we are announcing that all of our closures in the city of Hamilton will continue to May 25th, depending on what the virus does. So if it resolves itself sooner, we can go sooner, not possibly, but realistically, May 21st is the start-up date for any of our programs if we can and the virus is at bay. That is the date we're going to open up those programs, facilities, and restart some of the programming and non-essential services as well. Hopefully that we can adhere to that date, but if we can't, we will adjust accordingly down the road. During that time, the public can still do online business with the City of Hamilton. All of your councillors and city staff are available at their regular emails and phone numbers. Essential services will continue, and we will continue to monitor the provincial orders during that period of time as well. On our website, you can get all of our information, and all the appropriate channels are there. A reminder that leaf and yard waste will not be collected from here on. You are encouraged to either leave it at your home or take it to the transfer station. This is purely a manpower issue, a person power issue, and hopefully we can get all of the other materials collected without any problems. Leaf and yard is off the list at this point in time. We are accepting donations of personal protective equipment, PPEs, to throw out the short form. Much needed in our community for the COVID-19 emergency. The equipment will be provided to frontline workers and emergency responders and healthcare professionals. The type of equipment that we'll be accepting are including our surgical masks, N95 masks, impervious gowns, gloves, face shields, swabs, and hand sanitizers. And of course, homemade equipment will not be accepted. And we are requesting these items from local healthcare providers, pest control companies, hospitality providers, dental offices, nail salons, and construction companies. Whatever you might have that you currently aren't using because you're closed, please get a hold of us at ppe@hamilton.ca or call 905-546-2424 at extension 2257. And make an appointment for drop-off at a location in and around downtown. We will arrange to pick up whatever you have, and anything you have will be very helpful. Per the provincial order as well, for the weekend prohibiting organized public events and social gatherings of more than 5 people, please adhere to these physical distancing requirements. Stay at home as much as you can. Our municipal law enforcement and police continue to monitor these situations and will continue to enforce as per the provincial order. And tomorrow night, as per usual, we are having our virtual town hall starting at 7 p.m. Right here with Cable 14, also to be aired live on CHML. And you're all requested to send in your questions beforehand, if you can at all, by tagging us on the @City of Hamilton Twitter site or at www.hamilton.ca/ask COVID questions, and you will get some, hopefully some answers tomorrow night at our town hall. I'm now going to turn it over to our Emergency Operations Center Manager, Paul Johnson.
Thanks very much, Mr. Mayor. And just in terms of the May 25th date, I know people have been following what other provinces are doing and what our own province is doing. And there are a variety of dates out there. You're also looking at other municipalities making decisions as well. So our decision was based on a number of pieces of information that we received. But, you know, as the mayor said, this is really our next best thinking in terms of when we may be able to start to open up some of the facilities that the mayor talked about. So there isn't really magic in the date, although we are looking at some of the data around how we see this virus progressing through the community. But our hope is that late May may be an opportunity for some of these services to begin. And we will be monitoring and give, again, a fair bit of notice, but we do know that we were coming up on that April 6th date. I will say that over the next coming days, you will see some sub-messaging around this that will talk about some of the other programs that have either been suspended or things that we are doing differently in the community, which may not extend through to May the 25th. So we'll be looking at a variety of those things. They'll always be available on our website, and for some of the very important ones, we'll make them available at these press conferences. So today we thought it was important for people to understand that essentially the public access to our facilities and our buildings, the closures are being extended for a significant period of time. But we will have some future announcements about some of the other changes to services that have happened. For those that had bookings, they will be canceled, and refunds will be given, of course, as we've been doing across programs once we've closed them. And as you know, the mayor's mentioned a variety of our services continue to be available online, by phone. And the other piece is at no time do these announcements we talk about dates of closure and reopening potentially, they do not affect the essential services and the emergency services that Hamiltonians rely on each and every day. They will continue to be there for you. From an HSR perspective, given the provincial order that's come down, this is another chance to remind people that you know, HSR is there to be very supportive of the essential travel and things that we need to do. They are not there to be there for non-essential pieces, because you shouldn't really be out doing that in any form, whether you need transit or not. We are experiencing higher than normal call volumes on some of our customer service lines related with transit. If you don't get through to a representative right away, please leave a detailed message. They'll get back to you as soon as they can. Just recognize that some of our staffing has been affected as people return from travel and are self-isolating, and we are trying to make sure that each and every day we have our service on the streets. We are continuing to maintain the levels of service that we changed last week and started to make some adjustments to, and we've been able to maintain that. And I think it's important to remember that HSR is doing everything possible to help with the physical distancing that we would want to see on transit. We know it can't always be that pure up to 2 meter that we look for, but things like adding additional service on really busy routes, and ensuring that our larger buses are obviously going on the routes with more people are ways that we're helping the public to feel safe with their physical distancing. And we continue to work with our HSR staff, our drivers in particular, and our Amalgamated Transit Union leadership to review physical distancing procedures. And we're actually going to have some more updates on that tomorrow. But it's wonderful to see our transit system continue to operate in this community, you know, under some scary circumstances for our drivers. So wonderful that they and so many of our other folks are still out delivering the service that we need. Many people have been seeing in the media, and the mayor has raised it over the last couple of days, that the concerns about supplies, and particularly the personal protection equipment that is necessary in many of our work, much of our work that we do as a city that's related to the healthcare sector, and that's primarily with our paramedics, in some cases with our firefighters, and certainly in our long-term care facilities, to name a few. I will say that we are not in a situation where we have run out of supplies. I want to, make sure that people are aware of that. But we are very concerned operationally that not only are our supplies dwindling, particularly as cases grow, because oftentimes we're engaging with people that are screened as potential COVID-19 individuals, and that means we try and protect our staff in different ways. We're concerned about that growing number. We are going through supplies in a little bit of a heavier way, and we do know that the procurement of those supplies is right now fairly difficult. So some of these things that we're talking about and that the mayor has encouraged us all to do in terms of looking for ways that we can get more of that supply in is in anticipation that there's going to be a tightening of this. The one challenge with a global pandemic is everybody's wanting the same supplies. So I just want to assure folks that at the moment we do have supplies. We're really trying to make sure that they are there in the future. And for our staff who rely on these supplies in certain cases where they are absolutely working as people do in hospitals, working in very close confines with individuals, and they need to protect themselves, we're making sure that that's there. But it is a concern for us operationally, and I'm sure you'll continue to hear more about that. We were very pleased to hear announcements, as the mayor has indicated, that suggest that our national and provincial governments are doing everything they can to bring supplies into this province, because some of our usual places to go for these supplies certainly have dried up. So again, we continue to provide a great deal of services to the community. Really pleased that we are all settling in at the city to this new way of working, which for many of our staff members is working from home and delivering service in different ways. And I just want to commend them for keeping the work of the city moving forward. And as you'll see with some of the virtual town hall, virtual council meetings that will occur through the month of April, business will continue at the city. Our staff are doing that work and continuing that work as best they can under these new working conditions. Over to you, Elizabeth.
Thanks, Paul. So just a short update from me today about the number of cases. We're now sitting at 101 confirmed cases for Hamilton as of noon today. There are more details, of course, around the age, settings, all that sort of thing of these cases, but just to flag that still the largest number of cases are coming from travel. About 40%, 43% are still coming from travel at this point. You'll notice we went up an additional 10 cases today. We're still working our way through the backlog of results that are coming in from the Public Health Lab. They have made great leaps forward in terms of the number of cases they're able to process each day. So we're getting caught up overall in the province, and they expect to be up to processing 11,000 tests per day by Friday. So that's very good news on that front. We have 24 cases overall that indicate there's spread in the community where we can't find any other source for those cases. So while it's still third in terms of the source of cases, it's of course continuing to show the community spread that is going on. You've heard already about the updates that were coming out from the province last night, and there was a new directive that was issued by the Chief Medical Officer of Health when it came to long-term care homes, saying that all symptomatic staff and residents will be tested. And so this is the case for any outbreak, and including the one at Heritage Green. I did just want to comment on that this is a very difficult situation for the home, and understandably a lot of concern amongst the staff and families with loved ones at the facility. I do want to acknowledge the leadership and staff at Heritage Green who are doing everything they can to deal with the situation. We're continuing to work closely with them along with the Ministry of Health to manage the outbreak, and really do encourage those in the community to continue to support them as they do their important work. The new recommendations around outdoor recreation, as you've heard, really to stay quite close to home. And fresh air and exercise, though, do remain important for your overall health and well-being. It is fine to go out in the yard and do some creative things for yourself or with your kids, like jumping on a trampoline, playing catch or soccer out in the yard, doing some chalk art on the driveway. We know from our colleagues down in Windsor, Essex, there was a rather wonderful tribute to all the health professionals that are striving really hard to look after people who are ill and to reduce the spread as much as possible around this illness. Through some wonderful people doing those sorts of things down there. That's it from me today.
Thank you, Dr. Richardson. And again, a reminder, folks in the community, that even though we're relying on our healthcare workers to get us well or keep us well, the front line of this, the first line of defense is you. You can do what you're doing now, and what you're going to have to keep on doing for quite some time is avoid one another so we can avoid the spread. If you can do that, then the pressure on the healthcare system will be diminished, or at least flatten out, as they're saying, in terms of flattening out the curve. So everything that you're doing and everything that we're asking you to do is to prevent the virus from spreading, and spreading from one to another, from you to family members, as you gather in groups, which you are not supposed to do, but should you do, then you're putting other people at risk. And all of that adds to the potential overpowering of our healthcare system, and then potentially folks have done and continue to lose their lives, not so much here as yet, but in other places. You can see it on the news in significant numbers, all of them sad, tragic events that we're hoping to avoid here in Hamilton. So thank you for everything you're doing. You're doing a terrific job as far as I can tell. Some people aren't, and we'll continue to enforce that. If you have a complaint about that, you can call 905-546-CITY, and they will forward that call on to the bylaw enforcement and the police, and we'll do everything we can to encourage people to not gather in groups of more than 5, and ensure that we stop the spread, crush the curve, plank the curve, whatever you want to call it. Some folks are in crisis in our community normally, and this could certainly add to that, and there is a Coast hotline that you can call if you're having distress or worried about your state of being, at 905-972-8338. And if the Kids Help phone line is very, very much active right now, and there are potentially many kids that might be in a difficult situation at home, or just confused, or need answers and can't get them anywhere, you can text 686868, which is the Kids Help phone text message line, or dial 1-800-668-6868. If you're having challenges or problems and you need help, reach out. Help is available for you in a myriad of different ways. Continue to maintain that physical distancing, 2 meters, 6 feet, a hockey stick length, as some have indicated. Assume you are a carrier, and as of last night, it's been recommended that people over 70 self-isolate. In other words, stay home all the time. Have others provide some groceries, shopping for you, and stay home so that you can avoid this, because folks over 70 are even more prone than anywhere else. But we've also seen evidentially in the news that people of all ages are getting this, and people of all ages are dying from it. So don't take this for granted that you're going to be fine. Assume that you're a carrier, assume that you might get it, and act accordingly. If you want to do something positive, you can donate blood. Blood.ca is available, and certainly the need continues. And you can make a contribution to Hamilton Food Share as well. That'll be HamiltonFoodShare.ca. They'll be more than happy to take a contribution. Every $30 buys $100 worth of groceries, so they can really maximize the potential of your donation. And if you have money to spare and you can make it available to Hamilton Food Share, please do. They can certainly use the resources and pass that on to folks in our community that are having challenges helping themselves through this process. And that's it. So remember to go to www.hamilton.ca/coronavirus for any and all information you need about this event. All that information that you need is there. If you need more, you can always call the public health hotline. And on that note, we'll ask the media if they have any questions.
Just before we start, I'd just like to remind the media on the phone to please keep yourself on mute unless it's your turn for question. And we'll start with one question and one follow-up. Bobby from CBC, you're up first.
Thank you. I'm just trying to understand how we're counting cases right now. You know, I look on the website and it says we have 101 positive cases, and just 3 of them are from long-term care facility residents. But we know that there are 17 residents who tested or who have symptoms. So how exactly are we counting just COVID-19 cases, and who's showing symptoms, who isn't, et cetera?
Hi, Bobby. On the website are the number of confirmed cases, which are the ones that are confirmed by tests. Usually in outbreaks, what we do is once we've confirmed that the organism that's involved, the virus that's involved, we only test so many cases, and we don't go on to test others that are symptomatic. And so they wouldn't show up as confirmed cases. As of last night, the ministry has changed that approach, and so for long-term care facilities in particular, they're asking us to test every single person, whether they're residents or staff, that is symptomatic, to confirm whether or not they are COVID-19. So you would see only the 3 that are confirmed in long-term care facilities, and going forward, any of the ones that are related to long-term care facilities, they also will have a test and would get added to that number if it was positive.
Okay, I appreciate that. And also, I guess my other question here is, with different rules changing as to who we're testing, who we are, and there's a backlog, how do we consider 90 or 111 right now as an accurate reflection of the cases? And what happens as that discrepancy changes?
Bobby, we'll just ask you to repeat your question, maybe just a little bit slower. We just have a hard time hearing you here.
Sure. My question is, with the different changes to rules and who we're testing, with the backlog and testing, how can we know for sure that 101 is an accurate number, and how do we know if it's going to remain to be an accurate number or accurate figure?
So I think it's a really important point, Bobby, that you brought up, which is about what it is that the test numbers are telling us, the test positive cases are telling us versus what is actually happening in the community. And so the testing, because of the shortage of chemicals that are used for the testing, as well as the need to conserve the protective equipment that is used by health professionals when they're doing that testing, we've been focusing the testing across the province. They've asked us to focus the testing in these situations amongst those that are healthcare workers, those who are in long-term care, those who are travelers who have come back, and a couple of other high priority groups. So we know that we are testing a certain part of all of the people in Hamilton, and indeed all of the people in Ontario, and that there are more cases out there than the ones that are actually getting tested. And so the estimates as to how many more might there be, there's anywhere from 10 times to slightly more than that in terms of the actual number of cases that are out there in the community. That's why for anybody who is sick, it is very important that if they have any symptoms whatsoever, that they stay home. And the advice is, if you have symptoms that are at all consistent with COVID-19, that you stay home for 14 days, and a little longer if you're not feeling better at the 14-day mark, that you stay home until you're actually feeling well for 24 hours. So that the piece about the number of cases, it will fluctuate to some extent based on the ability that we have to do tests, but it is an indicator of how much spread there is, how many cases there are out there in the community.
Thank you.
Next question goes to Joanna from The Spectator.
I was hoping that Dr. Richardson, or I'm not sure if it'd be Paul, if you could talk a little bit about the announcement from Orange today that they will now have a base in Hamilton and expanding land ambulance for COVID-19.
So I just saw an email as I was sitting down to do the press conference. I haven't reviewed it. We'll get you connected up, Joanna, probably with the paramedic chief who sent me out a quick note. But rather than just read it aloud here, we'll get that connection made for you after the fact.
Okay, great, thanks. And can you talk about how many people are calling into your lines? Like, have you been getting a lot of offers for donation of equipment? Have people been calling in to report gatherings of over 5 or workplaces that they don't feel should be open? Like, have you been hearing a lot from people since you made that request yesterday?
So I don't have the pure volume. The good news is it's relatively small. You will see that the police actually have dealt with one physical location of a business and one that seemed to be a bit more of a mobile business in terms of drugs. But we haven't had a huge increase in those numbers. We expect we will now a little bit more because the order now is quite clear. There was a little bit of a gray area about gatherings when people were just walking along or utilizing parks, but I think those will go up. So we'll continue to monitor how that is. I'll ask for a bit of an update and maybe be able to provide that tomorrow once we see how we go through the first 24 hours of this order being very specific about people not using any of the amenities that are in public or private parks or recreational areas. And I'd include that the stress on the private. We focused a lot on city properties before. The reality is the request is there for private properties. This would include, for instance, condominium complexes. They need to close down their play areas as well. They're not to be used by the public.
Next question goes to Katrina from The Spectator.
Hi, this question's for Dr. Richardson. I'm wondering if you can provide an update on the current numbers of sick residents and sick staff at Heritage Green, and additionally, how many staff are currently self-isolating?
We don't have any updates to the numbers over those that I gave yesterday at this point. We are going to be working through with Heritage Green around the additional testing as we talked about, but so far nothing new from them in terms of numbers for today.
Okay, and I'm wondering if there's going to be, if testing for those individuals, the residents and the staff at Heritage Green, if it's going to be expedited.
Those are all the sorts of things that we're working through as we look at this situation, is how can we get those tests done, get them done quickly. We know, as I said, that the public health labs have come a long way. They've engaged with others like Dynacare and other labs to reach out and get more testing capacity out there. So we'll be working with them to see how quickly those can get done.
Next question goes to Samantha from the CBC.
Hello there. Thanks for taking my call. My question, I think, is to Dr. Richardson. With the new directive from the province saying that, people who show symptoms at long-term care facilities have to be tested, it made me wonder about our supply of tests. Do we have enough to fill that directive? Like, how are we in terms of testing kits?
So in terms of testing kits for now, we do think we have enough supply in order to do these tests. We are going to be working with the province as we go forward to continue to get that supply on hand. They did do a couple of weeks back. They went through a process where they identified what different kinds of kits that are used for different tests could also be used in these situations. So that did widen up some more test kits that were available. But this ongoing issue about supply of all the components is an important one, and we'll be continuing to monitor it.
I also just wanted to, on that note, is it your understanding that there is a shortage of those? We're competing with a lot of other areas to get our hands on those kits, and that there's a shortage in terms of the province and the federal government? Like, is this a concern for us?
So they have been having a hard time in terms of getting different components. At one point it was the swab that's used for the nasopharyngeal swab. That's the swab that's rather unpleasant, that goes all the way down to the back of your throat. Then they'd had some challenges around the reagents, which are the chemicals they use to process the kits. So yes, we're absolutely in competition across the globe for those resources in terms of testing for COVID-19. And we know that the federal government and the provincial government are working hard to find new ways to make sure those supplies, as well as all the supplies of PPE, can be there so we can continue to do the work.
Thank you.
Next question goes to Matthew from The Spectator.
Hello, I had a question specifically about how the expanded outdoor recreation order affects Hamilton. Are a lot of those things already covered by our existing rules, or how will our enforcement change as a result of that order?
So there are a couple things that actually do change for us. So in Hamilton, we had kept our leash-free dog parks open, had put up signage to encourage people to use physical distancing, but had kept them open. Those are covered in the new order. They will be closed. So they're not to be used. And I know that's of concern to pet owners and dog owners. But that's the reality. So there's a couple of instances where Hamilton now needs to comply, and we're changing our signs. And obviously, if they're used, our first line is always to inform people and educate people. But if it's a repeated breaking of the rules, then there are the ability for our bylaw officers or police to lay fines. For us, really, it becomes now rather black and white. So the other thing people will see is we are going to physically block off access to parking lots in a lot of the areas that would be these sort of trails and spaces where people have been going. And quite frankly, a lot of people visiting from a distance because they've had to drive there and parking and utilizing these facilities. We're going to take away that ability for the parking to happen. We will aggressively enforce if people are parking illegally on streets around them. And so I think that's one of the changes that will occur as well. We're going to make these less hospitable for people to actually travel to, and we weren't doing that as strongly before this order came out. So a few things have changed for us as a result of the order, and of course we now have some expanded powers to enforce that. And I think, you know, we talk about enforcement, we can talk about fines. Our central message is this, and when we do first run into people that maybe haven't got the message yet, our first instance will be to educate and let people know that they shouldn't be out doing this. But the more we can continue to talk to our family, our friends, our coworkers, anybody we connect with by phone or FaceTime or Skype or whatever, remind people that this is about staying close to home. Stay in your home, go out. If you have the ability to have a bit of outdoor space where you live, wonderful to use that. If you don't, if you live in an area where you need to go out, if you need some fresh air, then it's about walking around the block. And so if you back onto the beachfront trail down at the Confederation Park area, then you may be using that as a quick walking area. But it's not to drive there from the Central Mountain and park and use that trail because it's a lovely place to walk along our waterfront. So that's what's changed. That's what we all need to adhere to. But there will be some additional measures taken by the city to discourage anyone from using the pieces that were covered in the provincial order. The other piece, of course, is that we were working under a 50-person rule. It's now a 5-person rule. So there really isn't a lot of gathering that can happen that's going to be accepted anymore. 50 became, you know, some groups looked a lot larger, but they still might have been 30 or 40. The five maximum is there for a reason, and we'll be enforcing that as well.
Paul, I need to kind of go back at you on that. If you can still hear me.
Yep.
It sounds, some people have suggested to me that it sounds a bit like mixed messaging, whether that's obviously not the intent. But, you know, if we're saying to people who own homes, you know, hey, go use your driveway chalk or go use your backyard, that's one thing. But there are lots of people, of course, who don't have their own single-family homes or what have you, and they depend on the trails, whether or not they drive to them for their park for moving around. So are we specifically telling people to stay off the trails? Because I see those exempted in the local and provincial order, or are those trails only for literally people who happen to have them in their backyard? Is that what you're saying?
Well, the message is pretty clear. Stay at home unless you absolutely have to go out, and absolutely going out and driving somewhere and enjoying a trail because that's what you like to do because you don't have a front yard or driveway doesn't seem to me to be in the spirit of what the Chief Medical Officer of Health has been saying. So we are saying it's impossible to block off certain things and close it. So we use the beachfront trail as an example. I'm not sure, you know, we want to spend the money and the time and the energy to completely fence off a walkway for this period of time. But what we are saying is don't drive down there as a destination and use it. Walk around the block. I know for some people they back onto areas that are far nicer for recreation and enjoyment than others. But this is not the time for us to be picking away at that. we all have the ability to get out and walk around our neighborhoods, and for some, that may not be as pristine as others, but that's what we need to do. So we do know that lots of people live right near these trails and amenities, and the Premier was quite clear in his comments, you know, if you're walking through parks or you're walking through these areas, that's fine. Don't stop, don't congregate, don't use the amenities. But we've really been asked to only go out when it's essential. And I didn't see on that essential list that came out from David Williams that you know, going and traveling and getting out on a trail system or something that I really like to do on a regular basis as being part of that. This was about essential workers going to work. It was about groceries, medication, you know, helping vulnerable people if we need to support vulnerable people in our community, parents that may be self-isolating, older adults that may be self-isolating and dropping off groceries. That's the kind of stuff that we're looking at, and of course, taking care of your own health care needs appropriately. But outside of that, Matthew, the answer is pretty clear. Stay in your own area. And I recognize that that is unequal for people. But right now, that's the situation we're in. We're not going to be in it forever. But right now, that's very clearly the direction that we're asking Hamiltonians to follow.
Yeah. So Paul, sorry to sneak this in, but would it not then be simpler simply to say to locally ban the use of trails and parks?
I suppose so, but the reality is sometimes when you use that kind of language, then anybody that might be find themselves on there will say, well, now am I subject to all sorts of fines? So I take your point to, and you know, I know people would like all these things to be super black and white, and unfortunately they're not. To be honest, we said our play structures are closed. And you're not to use them, and people still use them. So, you know, if you want us verbally to kind of say you shouldn't be out on the trails, fine. But I do know that for some, they back right onto it, and that's where they would walk their dog on a regular basis. And I'm not sure that I want to say them, you're banned from using it because it happens to be your backyard. So this is where, you know, and I'm not trying to be argumentative at all, but this is the reality of what we're up against. If we go back to what
Hamilton, and the one thing that is not mentioned, I'm not seeing online, is if anyone has recovered from COVID-19, and also of the, I believe, 8 patients that are in hospital right now, are any of them in the ICU?
Thanks, Nicole. Yes, absolutely. We've had people that have recovered, and I think that's a really important point to underscore. You may see a little bit of a lag between the province and ourselves in terms of those recovered numbers. We actually have 29 cases that are now resolved at this point. So these are people who became ill, went through their course of illness, and they've now either passed through their 14 days and are asymptomatic, or in a few cases it may have taken a little longer than that. For healthcare workers, they are required as well to get lab evidence that they're cleared so that they can safely go back to work. And so we're working with anybody who's a healthcare worker and been a case to go back. So I think, you know, it is a really important point to raise, as I said, around the resolution. People do get sick. For most people, this is going to be a relatively mild or moderate illness, a bad cold, for roughly 80% of them, and they will go on to recover. And you can see already we've had 30% of our cases that we know of that have recovered. In terms of the other end of the spectrum, in terms of people who have been in hospital, at this point we know there are 8 people that are currently in hospital. 12 cases were ever hospitalized, and unfortunately we do have 2 individuals who are in the intensive care unit as of today.
Thank you so much. My second question, there was quite a lineup in downtown Hamilton today, 100 King Street West, people trying to get into local bank branches, we're assuming. I mean, videos showing that we have no one is physical distancing. There were dozens of people crowded together. What will the city do about this and to prevent it from occurring again?
So we're not there to enforce the physical distancing. We're there to educate. So I think we will look at where there are gathering spots. But you know, this is something we each have to take on. Today is heading to the last day of the month and the first day of the month, and so there is some financial, this is a financial period of time, and we talked about tomorrow being rent day and things like that, and there are also issues around social assistance that come out at the end of the month. So there are going to be times where there are institutions that are more in demand. The public is asked to to distance themselves appropriately around that. If we feel it gets out of control, certainly the city can step in. Just to be clear, when you're lining up for something, that's not considered a gathering of more than 5 people, because then we'd have to limit it to 4 or 5 people only in a grocery store at any one time. So there are differences that happen. We're monitoring it to see if it was ever to get to a stage where we needed to do something, but we're really just asking the public to recognize what we're being asked to do, and that's stay away. And if you as an individual go somewhere and you see too many people, you know, part of the exercise is you may decide that you'll come back later. And I know that that's, again, a message of, well, I don't want to come back later. I need to do it now. But there are only so many things that can be done around this. The encouragement is for everybody to try and work through this as best we can. Also, encouragement for business. I've been in grocery stores where I do see them trying to encourage the public to understand what 6 feet actually means. And so whether it's masking tape on the floor or what have you, I've watched grocery stores in particular protect their workers with plexiglass, but also indicate to the public where they should be standing. And I think those are ways that businesses can also help reinforce those messages.
Tevye, it's up to you.
Great. Thanks very much. Dr. Richardson, I just wanted to ask you another question regarding Heritage Green. Does public health still consider the 17 residents and 10 staff to be either confirmed positive or suspected to have COVID-19? Has the status changed for anybody?
So we are in the process of making that change. And so at this point, we would say we're going to step back. We're going to do that testing and see what the results are, and then we'll come back with those results once they're complete.
I guess as a follow-up, are there any more residents or staff that are either suspected or confirmed positive?
At this point, we don't have any new test results, and we haven't got any new numbers from Heritage Green as of yet.
Okay, thanks.
Just checking on the line if there's anybody that we didn't get to yet. Okay, over to you, Mr. Mayor.
Thank you very much, and thank you, media, for continuing to share information in the community at large. Again, a reminder to people that you are the front line of this effort. We're going to have to do this longer than we might have anticipated, and we're going to ask you to continue on with what you're doing. I would ask any businesses out there that are having people line up outside, they might want to put out a sign that encourages people to stay 6 feet apart. I know they're doing that within the doors of banks, for instance, where they're actually measuring out 6 feet and putting tape lines down, and doing that in grocery stores and at Nations, where I was at this afternoon. Very, very well done and very, very nicely separated and working very functionally. If there's a lineup outside the bank, maybe the bank could, maybe manage that process as well, but certainly we'll keep an eye on those issues. Let me thank again our American Sign Language interpreter, Rosalie Vizers and Georgia Whalen, both of whom are doing a fantastic job of translating for the deaf. We thank them for all of their effort, and we thank you for all of your effort. We know this is hard. We know this is difficult. We know it can be frustrating and annoying that we can't do what we'd like to do, what we normally do. We want to hug our grandchildren and be with our grandparents and family and friends and have a party. Unfortunately, right now, we cannot do that. And we encourage you to stay that way, stay separated as much as humanly possible, stay home as much as humanly possible. And if we're all able to do that, we're going to come through this just fine together. So thank you for all of your effort. Keep doing it. And we'll look forward to the town hall tomorrow at 7 p.m. right here, cable 14, and live streamed as well as on CHML. Thank you.